It was a great panel discussion, really kicking off our meeting here in the Carolinas with Dr. Nangalia and Dr. Levine regarding the role of both JAK2 and CALR in the pathogenesis of MPNs, but now really the evolution of therapies that may be more specifically targeted. So Dr. Levine, who's been both leading work as it relates to JAK2, mutant JAK2 inhibitors, which is a distinction from our JAK2 inhibitors have been very helpful, but they are inhibitors of the native or wild-type JAK-STAT pathway. Additionally, Dr. Nangalia, who both gave us really the blow-by-blow of how they discovered the CALR mutation, which was not easy to find, and that was fascinating. And then second, regarding how new CALR specific therapies are being developed.